Hi everyone, my name is Noelle Seifel, and the healthcare system that I've chosen to do this presentation on is Loyola University Medical Center here in the Chicago area where I am. So Loyola is a nonprofit Catholic care system. Loyola is the main hospital in the group, but the system acquired a hospital called Gottlieb about 10 years ago, and then another hospital called McNeil about a year ago. So altogether, they have the Loyola system has 3 hospitals and 35 other locations, such as immediate care and primary care clinics. Both Gottlieb and McNeil are community hospitals that offer just standard hospital services like, ER, rehab, urology, psychiatry, cardiovascular care, etc. Both are also listed as specializing in bariatrics and wound care. And Gottlieb has a 55,000 square foot fitness facility, which was the first medically based fitness center in the Midwest. I've seen it and it's huge. They also have a cancer care and research center. So Gottlieb is a 254 bed acute care hospital with a level 2 trauma center. McNeil is a 374 bed teaching hospital. And Loyola itself is a 547 bed hospital on 61 acres. Loyola was named one of the world's best hospitals by Newsweek this year. And then within Loyola, they have the medical school, Loyola University Chicago Stritch School of Medicine. And then they have the Marcella Niehoff School of Nursing. They offer BSN, MSN, DNP, nurse practitioner programs. So Loyola has a level 1 trauma center. And they also have the largest burn center in Illinois. And then, so all of this is actually also a part of Trinity Health. And Trinity is a non-profit Catholic health system with 94 hospitals, hundreds of other primary care and immediate care centers in 22 states. So when you're looking at the Loyola model, they first talk about serving in the spirit of the gospel. And they mentioned several times that they practice Jesuit traditions, which I had to look up, but it means Jesuits are members of the Society of Jesus, a Roman Catholic order of religion founded by St. Ignatius of Loyola, noted for its educational, missionary, and charitable works. So from the Loyola site, they say, we believe that our Catholic heritage and Jesuit traditions of ethical behavior, academic distinction, and scientific research lead to new knowledge and advance our healing mission in the communities we serve. As far as the professional practice model, the components, they have 4 components listed. First one is the commitment to magnet recognition program. And this lists as being committed to transformational leadership, structural empowerment, innovation, and the generation of new knowledge, exemplary professional practice, and empirical outcomes that demonstrate the impact of nursing in delivering high quality, reliable, and safe patient care. Loyola is the only hospital within the Chicago area in the Trinity network that has magnet status. I actually work for Gottlieb, and as far as I know, there are no changes being made so that they can receive magnet status. They have LPNs and RNs employed with no requirement for bachelor's degrees. Okay, so back to Loyola, the second component of the model is shared governance, which they define as leadership and decision making that incorporates the perspectives of those who are affected by decisions, and a philosophy that respects expertise and knowledge of all associates involved in patient care. Shared governance should also permit nurses to fulfill and expand their roles as integral members of the professional group. The third component is evidence-based nursing, and the Loyola site states this is endorsed by Trinity Health nurses as a method of evaluating nursing to the highest levels of the profession. And then Trinity specifically says that they use the Iowa model of evidence-based practice as a framework for selection, implementing, and then evaluating the changes. And then Loyola's fourth component is listed as using care models to help staff develop healing relationships with patients, families, and colleagues. And then Loyola lists the specific models being used. It's the relationship-based care, Jean Watson, Joanne Duffy model, and the Kristen Swanson model. And then I also just wanted to mention, since Loyola has this written everywhere, like if you're on the train and you see an ad for Loyola, they always have written, "We treat the human spirit." It's written all over all the hospitals. So as far as compensation and rewards for nursing, they have annually, the Marcella Niehoff School of Nursing has a Spirit of Ignatius Award for the nursing school alumni. And then they also have an award called the Damon Award, which is similar and also presented annually for nursing leadership. And then the hospital also has the Magistar Awards, which when the nurses get those awards, they have these tiny little metal stars that they put on their badges. And you can see some of the nurses that have worked there for 20 years have so many stars, their badges are kind of falling over. But that is just one of the other awards that they use for nurses. So Loyola's mission is adapted from the Trinity mission, and they actually have a link to the Trinity mission underneath their mission. The professional practice model is very clearly written, and it clearly provides framework for nurses that work at the hospital. They really have their models separated for nurses, physicians, families and patients. So if you read all over the site, you can definitely see that they use an interdisciplinary approach, but they don't really have it written all together. One thing I do want to say is, when I was reading through all of the information, they really put such an emphasis on education and how important it is. But I could be wrong, but I don't see anywhere that if you work for Loyola, you get a discount when you go to the nursing school or the medical school. And Loyola is very expensive, very expensive. They do have a tuition reimbursement program, which is great, but it wouldn't even cover maybe 2 classes a year because it really is expensive. Which is okay. It's not the responsibility to pay for it, but I did want to mention that because I don't think it really aligns with what they're saying completely. Either way, Loyola it's a really great hospital. And even though I only work at one of the little spin-off community hospitals, I am really very proud to work for Loyola. They're just known for being a great hospital, and I like working there.